Typically at least every 3 years, get your blood checked for what's called a lipid panel. So that will check your total cholesterol, your good and bad cholesterol, and your triglycerides, which is essentially like the fat in your blood. A elevated LDL, which is your bad cholesterol, that's most synonymous with plaque buildup in the arteries. That's the cholesterol that we want as low as possible, ideally below 100. Triglycerides, again, is like the fat in your blood, kind of like that oily aspect to it. We like that value below 150. And we also like to see your good cholesterol, which is your HDL. That's mostly increased with exercise. So the higher the number, the better, because that's like your protective cholesterol. So exercise, making sure you're exercising at least 3 times a week. Diet, Mediterranean diet is always recommended as far as an overall heart-healthy diet. Otherwise, decrease intake of like your fried foods, your fats, your like red meats. Fried and fatty foods are a very big indicator of high cholesterol, because restaurants, to make the food taste delicious, they have a lot of additives in there that can increase your cholesterol. The same with fast food. Reduce intake, you don't have to completely eliminate, just reduce. Some supplements over the counter. Red yeast rice that you can try, it's once daily. It's basically like a natural cholesterol medication, and omega-3 fish oil. That is really good for helping to lower your triglycerides. So you can get that either as a capsule, a supplement, or eating a large amount of oily fish, like salmon. So for your LDL, your bad cholesterol, anything above 100, we would be having a conversation, talking about your diet, your lifestyle, things like that. If it goes above 190, it is recommended, regardless of your history, to start a medication for that. Typically it's a statin, like a atorvastatin, also known as like Lipitor, Crestor, those kind of medications. Below that, typically I would start recommending lifestyle changes, red yeast rice, things like that.
Right.
If you have a history of diabetes or any kind of history of a heart attack, things like that, then we would have a conversation to bring those numbers down earlier, more aggressively. Dizziness, fainting, headaches, things like that, we can also check. Carotid arteries, listen for what's called a bruit, which is basically a noise that is made in the artery because of plaque formation, or get an ultrasound to make sure that there's not a buildup of plaque here in the arteries. It's a big place that it likes to hide. Also a referral to cardiology for a stress test.